Hey, I'm Max. I'm here to talk about my story and my journey. In July 2019, it was 1 year after I started my current job, I joined a US team mission, Go Dogs, as a translator. On our way back to the hospital, we stopped at a rural clinic that was 6 miles from the hospital, and a long queue of patients was waiting. It was evening, and only because the Wazungu people were coming, and so many people were waiting. Even people who have spent most of their time outside and even disappointed of the healthcare system were coming to see and hoping to get support from our team that day. Tamasha is one of the young ladies, 26 years old, a mother of 2, who came in the consulting room. And she started sharing her symptoms. And she had a headache. She felt a number of, she was just trying to explain the pain and how she couldn't sleep for a while. And the unsuccessful visit she had on previous rural clinic and hospitals, and how she changed the doctors, and how she's been with the pastors and traditional healers, but without success. Dr. Evans started asking questions about her life. And she started sharing the nightmare of what she's living in her marriage. And she bursted into tears. A minute of silence continued. It was long to finish the consultation. And at the end, Dr. Evans said, Tamasha had moderate depression. Looking back on Tamasha's scenario, all the time she visited the health facility for similar symptoms, she received a number of checkups. Blood samples were collected to check for malaria and infection. And when nothing was found, then some acetaminophen or paracetamol was given. And Tamasha went back to his home, same environment, same situation, and kept moving from one clinic to another and changing doctors, but with no success at all. I was shocked by the number of people with mental health conditions in our area, while myself and my colleagues couldn't pay attention to it. From this mission, I realized that human beings should be taken care of as a whole. And how and why I find myself in the Nundu area, a rural area, serving the poor people with almost nothing. My story started back in 1996 when the war broke out in my country. I was 13 and we went to Tanzania. As a refugee, my father was involved as a community health worker. And I remember one afternoon, my mother was from a funeral of my uncle's wife who passed away after delivery. And my father was sitting just in front of her, trying to share the situation in the camp. And he said, we have poor maternal and infant health outcome here because we don't have qualified physician. And I was leaning on a small house that was in grass, and I built it myself at that. I was 15 at that age. And looking into my father's eyes and how we felt powerless to change that, and I was like, I should be a doctor so that I can come back and treat my people. As a young refugee boy, I had no chance or opportunity to study medicine. So I decided to go back home to my country, the Congo. And of course, it was not safe. And my father was very concerned about my safety back home. My determination was so strong that my father's fear could not stop me. And after graduating in medicine, I could not go back to the refugee camp because I've lost my status of being a refugee for going back to my home country and spending all the time out of the camp. So I joined a clinic in Bujumbura, Burundi, which is a neighborhood country. We had a very good number of deliveries, but we had no neonatal unit. So all the time we had preemie babies, and some of them were dying only because we needed to send them to the other clinics, and they couldn't get an incubator or anything to help them. So I decided to spend my time trying to initiate the neonatal care at Devan Norman Clinic. And of course, we were able to train nurses with an online program, and we established the peer mentorship among mothers, and also we equipped the NICU. So this effort was recognized by the Brown Masters Award for Professional Excellence. And 1 year later, I visited my home country, and I went to the hospital I was born in. And when I was there, I couldn't see anything that could take care of babies with similar problems. So I asked myself, if I were born here prematurely, so I could have died. And I felt like it was unfair. So we needed to have a NICU there. And I decided to move back to Congo. And it was a very hard decision to make because of the political uncertainty and some of the rebels group that remain active in the country, and just the corrupted system, without the infrastructure, lack of opportunity for my own children. But my wife was like, if you want to do it, so you can do it. And she was very supportive. And I went to Congo anyway. So I duplicated the neonatal project, and the unit is saving also more babies right now. But it took me 1 year until I understood that the mental health problems was another serious conditions that was happening in my area, and I couldn't realize it until when the Go Docs mission came in. Then I was a translator, then I understood how serious that was. Of course, the Congo has been named as the capital of rape, with ongoing as a chronic conflict area, and where gender-based violence has just like a culturally accepted situation. So I wondered, how will a woman mentally unstable be able to raise successful children? I was asking myself, if action is not taken right now to mitigate this, when should we do it? And I felt it was also, yes, a concern of one woman at a time, in one country, in one continent, but for sure, I knew its consequences should affect in one way or another the world. So keeping silent toward this was an unfair thing, so I decided to work on it. So during my journey, I had started working together with my colleagues, trying to build a team, analyze together ways to integrate mental health care in our daily practice, so that physicians and nurses can be able at least to recognize this is a mental health problem. Beyond physical and other problems, there is also mental health problems in our people. And also be able to take care some of the mild and moderate conditions, because we only have 2 psychiatrists, and they are all based in Bukavu for the South Kivu province, which has almost 6 million people. So I got a team of volunteers also from US who joined the team, and they are supporting our staff locally. I also were lucky to get a small grant from Project ECHO, and we just equipped our hospital with a video conferencing room, which is now active right now. But as I started, things didn't go the way I expected it. So I was planning to extend the project for the whole district, because I knew that mental health problem could happen and people could go to the rural clinic, could go to many other places. But an all-out strike started for nurses in those rural clinics. So it was very difficult to organize them. And then I decided to change the focus of my project. And I started working on the small group in my clinic. And then the ongoing instability in our area led to massive internally displaced people arriving into our area. And this attracted a number of international organizations working on different interventions, including mental health. At the beginning, I called them, those organizations, competitors. But the coaching in this program taught me that it is all dynamic and it can change. So I should explore possibilities of collaboration. We learned the power of one-on-one meeting, how to build relationship, and of course, I got support for the project. And the International Medical Corps provided mental health training to 13 staff, including doctors, nurses, and midwife in our clinic. So during my equity journey, what I learned and applied cannot be summarized in a few minutes, from the storytelling to the coaching and so on. I applied the learning in my personal life, learning to delegate power, thinking about health equity during the planning at the hospital when it comes to groups of underserved people like the poor, the refugee, and making our hospital a safe place for different groups of people, creating the Jali AFHE nonprofit so that we can reach more people than the hospital could, and integrate the new concept of health equity in the French daily life. The Atlantic Fellows for Health Equity helped me discover where I am most needed. I had thought before that to quit because the government is not supportive to our effort, a lot of injustice, greed and corruption, war, which just exacerbated inequity in all sectors. But all this far from my own family. But being in this program, the coaching, the support from peers gave me energy and helped me understand where I am most needed. And I understood this. Good times are for everyone, but it takes to the leaders to make change happen during the hard times. So for all of you, and for myself, Congo needed me for a lot of problems it had. And for all of you, all the inequity around you is the reason for you to be there. Thank you.